Welcome back to the Agweek podcast. I'm your host, Al Windmill. I'm here with two guests who are not in traditional agriculture, but they do work with people in agriculture, plenty. And they're in the Red River Valley, so agriculture is a part of all of our lives, whether we like it or not. We have Dahl and Kristine Martens from Resurgent Health in Fargo. Welcome to the studio.
Thanks for having us.
Thanks for being here. You guys
Jinx. Jinx,
well,
1, 2, 3.
Well rehearsed on that. So we have you in here. Like I said, you work with people in agriculture. I've talked to both of you about this. I think Allie's even said farmers are some of her favorite patients for various reasons that we'll get into here in a little bit. But you guys started something new that's been super intriguing as a guy following along. You're doing direct primary care, which is a different way of helping people in healthcare.
Mm-hmm.
Can you just explain what direct primary care is?
Sure. It is basically a membership model of family medicine or primary care rather than using insurance to see your primary doctor. So it's still the same care. You know, you can still go and do your well visits, your annual physicals, all of the things. But instead of paying for every appointment that you go to, you're just paying a monthly membership fee and you can come in as often as you need to. And
Whether you don't go or...
Yeah, whether you don't go or whether you're there 10 times that month, it's the same monthly fee. And then you also have a phone number that goes directly to one of us, whoever is your provider.
Mm-hmm.
So you can text or call like directly to your provider. So it's really just a like
Video appointments too, if you don't want to leave the house?
Yeah.
pretty much anything that you want to do. We want to have relationships with patients again so we can take good care of them. And it's hard to do in the traditional
It's hard
arena.
Insurance-based system. Yeah, I think a lot of people get confused on like what does direct primary care mean? And I always tell people like it's no different than a traditional system. We just don't contract with insurance. We contract directly with our patients. You know, and I think a lot of people have heard, we just talked about this last week, like people have heard of concierge medicine. And that's kind of what it is, except it's concierge medicine without the high price tag. It's affordable. It's, you know, we're very transparent in our costs so that people know exactly what they're going to pay before they come in, whether that's the monthly membership fee or if there's additional things that we do for them. They'll know that. It's listed directly on our website. So you don't get a surprise bill in the mail, you know, 3-6 months later, or you don't go into, you know, basically bankrupt yourself with your medical bills. Yeah.
I feel like it's money first that people worry about, but really it's the care and the access to their providers. I've felt rushed out of visits before. It's not a feeling. It's not a fault of the provider.
No.
It's the system, and I understand that a lot of people probably don't.
Yeah.
But you guys change that, and it's like you have access to us. We're not in a rush. We're
Yeah.
here to make sure you guys feel good and get the care
Right.
you need, which I can't say enough good things about.
Yeah. And I think like a lot of people in the public don't realize that, you know, most of us get nowadays, it's 9 minutes per patient in a traditional setting. We take on over 2,000 patients in a traditional insurance-based system. And we do that because of the insurance reimbursement rates. They've gone down for primary care. And that's why people feel like you're in a factory. We're pumping people in and out. We don't have time to talk to you. We don't have time to get to know you. We're referring to specialists left and right. And really in our setting, we're taking on a way lower amount of patients. You know, we've talked so many times about this number, but it's around 400 patients each that we're going to take on because we want to always, deliver what we're promising, basically, that longer visit time, the individualized care that we really want back in medicine.
Right. And other point that I think I made to somebody else the other day that I was like, oh my God, that's like a really good point, is that even if you have the best primary care doctor that you can maybe get in with or spend time with, the motivation is still skewed a little, you know, because the only way that a doctor or provider gets paid at all by the insurance company is like when somebody is in their clinic sitting there having appointments. So there's always going to be that motivation to like fill your day, you know.
Come on in and see
you need
us.
to, come in and see me. I can get you, I can squeeze you in because that's the only way that you get paid for the job that you're doing. And so the way that we're doing it is actually we're more motivated by the opposite. You know, you're paying me to keep you healthy.
Mm-hmm.
It honestly makes my job a lot easier if you don't have to come in all the time. So I'm going to do what I can do
Everybody has their own
like
preferences
keep you
on how
out
that
of the
is too,
clinic.
right?
Yeah.
Yeah. And that way, when you do get sick and you need to come in right away, then there's always going to be that availability. But
Yeah. And I think like people, it's all about convenience too. I mean, we live in such a society that's like high paced. We don't have time to go in. And especially those of us who have kids, it's like we don't have time for our kids to be sick even, right? We're frustrated when our kids get sick and we have to take time off work. Well, then you add, okay, now I have to try to find a doctor's appointment to get my kid a letter for school, or, oh, now I'm sick and I have to go in. But then you never can see your primary. Whereas with us, you can text us, you can call us, and a lot of our care can honestly be done over a text message, over a virtual visit, because we're being paid monthly to do that. And we're much more motivated to do that versus like, don't come into our office if you don't need to, right?
And we know them, right?
Yeah.
Like it's not like, when you're going into the urgent care that person doesn't really know who you are. So of course they're going to want you to come in so they can talk and see if you have that same sinus infection that you have every year. Like they don't know that you have that same thing every year. But like your primary, if you have a good relationship with them, we know like, oh yeah, this is the same thing and I know what antibiotic usually works for you. Yeah. And we can just do this really quick. Yeah. So I don't know. It's a better way it's been way better for us. Like it's more satisfying. Like we can actually like
feel
take
better
care.
about it.
Yes. I feel like I'm not motivated by making you
Insurance
interrupt your
companies,
life and like come in so that so that I can get paid for the advice that I'm giving you. So like it just makes more sense
Overall.
Yeah. I'm really hoping that someday there will be an actual shift where primary care is considered completely separate from insurance altogether. So like insurance can be used still for your hospital and your ER and your even imaging and specialists and this type of thing, but that you have your insurance plan and then you have your primary care because they're different. Like we are actually trying to prevent you from getting sick. Insurance is just covering you when you are.
Right.
Yeah.
I mentioned earlier that you have patients in agriculture, various parts. Why do you think direct primary care is such a good fit for folks in agriculture?
Yeah. I mean, I grew up in rural North Dakota, so obviously grew up around farmers my entire life. And everybody knows during farming season, planting season, harvest season, who has time to go into the doctor on a general basis. But for farmers, they don't have time. They're working 20 plus hour days. So direct primary care, I mean, just like we said, it's so much more convenient for people to be able to text us, video visit. I video visited with some of my farmers during harvest season, like while they're in the combine, and they're just sitting there,
Take a break?
No, they can't. And that's what's so convenient about this is for a monthly membership, I mean, you pay for whatever we're providing, right? You don't have to leave the combine. You don't have to try to find somebody to manage that. And the problem I see a lot is that instead of them going, oh, I'm stressed about going in, they just forget about it, right? They like don't even think about it. It's whatever. I'll just go in when I need to go in, and it creates this reactionary approach to medicine. And so, yes, farmers are one of my favorite people because their stories are great, but also just because of the convenience that we're able to offer, and what we're able to offer in rural North Dakota too is huge in our clinic.
Yeah, we are the only ones in North Dakota, so and we can help anybody virtually for as far away as you. However,
as long as they feel comfortable with it.
Yeah.
That makes perfect sense. We've talked about the cost and how it can be, a major savings. It's a different way of thinking, so there's a little bit of a shift there. But I also know that you work with businesses trying to help on a greater scale and fill in where some of the shortcomings of traditional healthcare, hit businesses in particular. Farming's a business.
Yeah.
What are some of the economic benefits to a farmer adding your care to their benefits package, whether that's just the owner operator of the farm or ranch or, passing along to their family and hired hands? How does that look in your eyes?
I think I love this question because I actually just touched base with my brother-in-law, who's a farmer down in Oaks. And I've heard it for several years that they always struggle finding good help, hands-on help in the business because of the lack of insurance that they're able to offer. The insurance premiums are sky high. They just can't offer health insurance to anybody. And so a lot of them rely on their spouse, or they go out onto the market and find their own health insurance, or some of them don't even do health insurance at all. So I think it's a great addition. Yes, we're starting to offer it as, to small businesses, but I think like you mentioned, North Dakota, it's for a fourth of the employment in North Dakota is agriculture. And I think that's huge for us because if they can't afford insurance or they're not able to find help on the farm and that's affecting their business at home or whatever it may be, this is such a great option for them. And we do have to say we're not a replacement for insurance. But at the end of the day, I totally understand that there are a lot of people that just don't get insurance, and we don't want that to happen. We don't want people to go without some kind of health benefit, and this is a great addition for them.
Right. I mean, it's for all of the same reasons. Like it's much cheaper than insurance plan. Obviously, it's not a replacement, but if you're already not able to offer them health insurance, but you can offer maybe a different benefit called direct primary care, then at least that person has access to somebody who is available for them all the time, can try to keep your employees healthy, and then you don't have as many sick employees. They're working more. You can be seen when you need to be seen. It's not like that, an employee who's like, well, I can't get into my doctor until X date, so I'm going to need to be out for however many days. Like that's no longer going to be an excuse if they use us as part of their benefits. But yeah, I feel like that's going to be huge once we start rolling it out, which we have just started rolling that out.
Yeah.
So.
Good.
Yeah.
What are some of the unique health challenges that farmers and ranchers face?
Oh, lots. I mean, I could list a ton, but I think the ones that come to mind are like musculoskeletal injuries, right? I mean, they're bending, they're lifting, they're putting so much pressure on their body that over time that's going to cause them to have back pain, aches and pains every single day that they wake up, and they push through that. And I think the biggest thing in our clinic is, yes, we do primary care. We're a little bit more, we don't want to just push medications at you, right? We want to also heal your body from the inside out. And Dr. Martens actually just started doing osteopathic manipulation techniques, which help heal some of that musculoskeletal stuff, help with the pain. And I'll let her touch on that a little bit too. But the other thing that comes to mind with farmers that I hear consistently is stress, right?
Sure.
They're stressed about the market. They're stressed about the crop prices. They're stressed about the weather. Or, okay, am I going to be able to get out there and plant and harvest? And then they bring that stress home. And a lot of times growing up in rural North Dakota too, you see a lot of them just self-medicate with alcohol and it's sometimes drug addiction, or they just say, I'm fine, everything's fine, right? Most males do that anyways, but I mean, that's just the reality. But at the end of the day, we want to be there for them even during those challenging times because we can talk about, okay, how do we keep you healthy? So I'll let her talk on some of the...
At least like going to the doctor doesn't have to be one of those stressors anymore.
Right.
Like if you
Absolutely.
have your appointment that maybe you are somebody who wants to go and then the weather keeps you out, you don't have to worry about having to travel in bad weather because you could never get in to see them again. You can just like do it virtually or come in the next day. We don't have to be a stressor anymore.
And you don't require appointments to be 6, 9, 12 months out.
No.
Go see me tomorrow.
No.
No. In fact, our EMR, our like electronic medical record for like scheduling, I think I want to say it's only 2 months, maybe 3, that it goes out automatically.
It doesn't even let you go.
It doesn't even let you do it
anymore.
because most of the time people are just making appointments that week. But yeah, so like Allie was saying, I do this osteopathic manipulation. I don't know if you've ever heard of it, but it's
Luckily
basically...
I haven't because I feel like if I knew about it, it's because something went wrong.
Oh, actually, so I'm a doctor of osteopathic medicine, a DO. So it's just a different, vision of medicine, a different medical school. And was trained to do manipulation techniques in school and in residency, and just sort of stopped doing it when I got into the real world where there's just no time to like do any of it. So now that I'm out, it's a hands-on technique that's more gentle, I guess, than chiropractics. Maybe a mix of like massage and chiropractics. Those are the two things that people are familiar with.
Yep.
But the whole concept is to try to keep your body in more alignment, to try to help it to do what it can naturally do best, which is heal itself. So, which can be very helpful for various pain syndromes, including like acute back pains and things like that, but also like prophylaxis to prevent migraines. And there's other like visceral things, GI problems, that type of stuff that OMT or osteopathic manipulative treatment can be good for. So So yeah, we
Lots of benefits.
Yes, lots of benefits.
Yeah.
I mean, we're the only ones doing it in the city right now. I know that one of the bigger systems used to have a couple of osteopaths doing the manipulation techniques there, but
But no longer?
they've since all left.
Okay.
So right now, I'm the only one in the city doing it. So yeah,
It's very cool.
Yeah.
What about nutrition? I think of farmers, I think of home cooked meals, and I think of deliveries out to the field during planting and harvest and spraying season and all that stuff, which the deliveries might be better than whatever else they can scrounge up. Do you have any tips for farmers for nutrition? I know that's a big thing for both of you as well.
Yeah. I think that if anything, they should give us some tips in the city because I find that, like you said, Al, they're so much more in tune with whole cooked meals. And even when we go home, it's like, wow, this lifestyle is so much slower than the city, right? Like we're always like rush, grabbing the quickest thing to eat in the city. And you go home and it's like a home cooked meal every single night. But I think nutrition is very important for your body. And like we said, healing it from the inside out. And do you want to touch a little bit on nutrition? I mean they're
you're
doing a
probably
great
the best
job.
at nutrition between the two of us, but like I mean, the one thing I can think would be not just like what you're eating, but when you're eating it. And I imagine farmers are up at all hours of the day. And so depending on what health issues that person might have, just tips for, trying to be full earlier and not eat so late at night. But
Yeah. I think the biggest thing too that I reflect on a little bit with farmers is a lot of them that come and see me anyways will always talk about, I love that you don't put me in a checkbox. I love that you don't tell me I have to change this dietary habit. And the reality is I don't usually do that with a lot of my weight management patients either, which is something we practice in our clinic. And I don't do that because it's individualized, right? I understand you're up 20 plus hours a day. I'm not going to sit here and tell you, don't drink that cup of coffee at, 10, 11
Pound of
o'clock at
energy
night
drink, right?
because you have to sit there and operate a heavy machinery. Like I'm not going to sit there and tell you that, but we tailor that, we individualize it, and we go over each of those things. Okay, what are you doing that could be contributing to your high blood pressure? What are you doing those little changes that you could make? Less salt intake, how many pops are you drinking a day? Some of my farmers drink, a 6-pack a day of Mountain Dew. And we go, okay, instead of cutting that all out, let's cut one down, right? And see how you feel. Let's add more water. So all of those tips I think are super good. But I think one thing to really remember is we don't just put you in a box, right? Nobody fits in a box. And I think that is what happened in the traditional setting is that we have all these metrics we have to meet and all of these check boxes. And then that has caused people to not want to go in either. So
that's what makes it hard to even give even generic advice about nutrition, because it is totally depends on that person.
Yeah.
The person, their situation.
It's hard to, you can't Google what's the best meal for, me or a farmer or whatever. I mean, you probably could. There's probably an answer out there.
Right.
But everything is just so multifactorial. Just I have a hard time anytime that there's a question what should I do for this one thing, or what should I tell any group of people
struggling? That's the same with our weight management. It's
depend on
what diet should we follow.
How old are you? How many kids do you have?
Exactly.
When you go to bed, what do you do for fun?
It's
what do you
just
do for living?
individualized.
There's just too much that's involved with that.
Yeah, very much so.
Do you have any other practical steps that farmers and ranchers can take to improve their health? We talked about a lot of things: nutrition, mental health, physical health, preventative care. Any great standard tips? It's a dumb question to ask after we're just talking about everybody's different and everybody's situation's unique. But any general tips that would be helpful?
I think the biggest thing that I think of that comes to mind is, a lot of, I don't even know the percentage, maybe you do, Al, but the percentage of men in ranching and farming, right? I mean, it's pretty high. There's women, yes, of course, but women are just more notorious to go into the doctor. I think a lot of men avoid it. And there was a recent study that I've talked about, I think, for the last month and a half to everybody I can talk about it with. But by 2050, men's cancer rates are going to go up by 90%, was a new study that came out. And so my tip is don't avoid going in. There's other options besides just a traditional setting that makes you miss work and makes you miss hours. Prioritize your health, because if you are the person that is the breadwinner for the family, the person that's farming and bringing in all of that revenue, or even the food to the family table, you need to be around and you need to be around long term. And so put yourself first. It doesn't make you selfish sometimes, right? So
Doesn't make you weak.
it doesn't make you weak for
No.
saying like, okay,
I
maybe
need
everything
to get this
isn't
checked out.
fine. I need to get this checked out. And I think our system just helps prioritize that even more.
Don't lose faith in the system. I mean, you can lose faith in the other system, but
Lose faith in the insurance
there is
system.
another way that is much more
Yeah.
comfortable, much more personable, easier for your lifestyle. So just like consider the idea that there is something different out there.
Yeah.
I think at Resurgent Health, I think customized care, affordability, transparency, and connectedness. You're connected to the person.
Absolutely.
I see a few doctors and I feel connected enough, but not like your patients feel towards you guys.
Yeah, absolutely. Absolutely.
The best way to take care of somebody is if you actually do care about them and you know what's going on in their life.
Right.
There's all of that stuff factors in on all of your health stuff. So
Yeah.
I don't know, it's enjoyable.
And I think like Dr. Martens and I both have joked that we both were probably direct primary care providers for as long as we can remember, but just in a system that wasn't made for us. We'd always go home with lots of charts open because we would spend the time with our patients. And that shows because a lot of our patients have followed us and we're so grateful for that. But I think like this just needs to be talked about more often about it's not the provider, it's the system right now that is wrecking healthcare. Yeah.
I know you guys have room for a few more patients. What is the best way for our listeners to learn more about the direct primary care model and Resurgent Health and how they can work with you?
We have a lot of information on our website at resurgenthealth.net.
Perfect.
We are offering free meet and greets, so they can call and schedule that at the office, or that's also something they can sign up for online on our website.
Yep.
Those are probably my two best ways of getting more information.
Yeah, I would agree. I think the free meet and greets, people always think like, well, what's the catch, right? Like if I sign up with your clinic, what's the catch? And there is no catch. There's no
gotcha.
long-term commitments. We don't keep you forever. We don't mandate that you stay in our office for years and years, although we would love that. But the free meet and greets, there's no catch associated with that either. I mean, they can schedule it, and we're offering it even after hours to come meet both of us, because I think it's good just to meet directly with both of us instead of, okay, schedule a meet and greet, but who's that going to be with? So we do offer those Monday evenings from 5 to 7 p.m. and then also Friday mornings as well. Even though our clinic is technically closed Fridays, we offered free meet and greets. And then they can be scheduled any other time during the week if it works for them too. Yeah.
Perfect. Well, thank you both so much for being here and sharing those great tips and sharing the story of your clinic. It's awesome. It's inspiring.
Yeah.
Thank you.
Hope
Thanks for having
to
us.
talk with you both soon. And thanks again for being here.
Yeah. Thanks for having us.
Anytime.